Hi, providers. Welcome back to the channel. The January 2021 Healthcare Hero Award goes to Dr. Rich Severin. Dr. Rich Severin is an amazing physical therapist and hero because, as you know, on this channel, we recognize the heroes who think a little bit differently than others, who are able to increase the impact on their communities, the industry at large, as well as their patients. And this man is a beautiful example of this award because what he has built has been done to serve others. He's someone who's learned from mentors, who's now mentoring a lot of different people in the various capacities, but he's incredibly humble about it. And so as we listen to him, I want you to focus on a couple of things here. He talks beautifully about a vision for physical therapy, as well as the barriers that we must overcome to get there. And if, as a new grad or a student, if I had heard that, I think it would have dramatically changed my perspective, as well as help me discover what's possible. Remember, what we do on this channel is to help you increase your income, impact, and freedom. But ultimately, what we do is help you think differently so that you can discover what's possible. And this is a wonderful interview that I am so excited for you to listen to. And let's get to it right now. Dr. Rich Severin with us here today at the Profitable Provider. Rich, how you doing today?
I'm doing pretty good, man. I'm excited to be on here. It's just looking at the people you've interviewed on here and Heidi and other people. It's quite an honor to be on here, and anytime to share your thoughts or your voice with other people, it's always it's a privilege. So
yeah, you are the official, for those who didn't catch it from the thumbnail. Dr. Severin is the January 2021 Healthcare Hero Award winner. We are so grateful that you took some time to share with us some of the things that you've created, you've done. The reason we've created this award, the Healthcare Hero Award at the channel, is because we want to highlight those brave men and women who've gone out into the profession, who've made a greater impact through their service, through what they've created. And Rich is no exception to that. What he has done has, he's been created as a physical therapist. He's created himself as a professor. He's also a huge influencer. And what I have told him, and I will share this because we had a brief conversation beforehand, is that Dr. Severin is easily one of the most significant influencer to the rising generation of physical therapists. So Rich, congratulations. Thank you so much
Thanks,
for accepting this award. And for the viewers and people who don't know you, I'd love for you to introduce your background. Could you talk to us a little bit about, let's start off with why you became a physical therapist and go from there.
Yeah, it's a very long story to that, and without getting too deep into the details, but I didn't even know what a physical therapist was really until my junior year of college. And I grew up in a pretty rough beginnings, or humble beginnings rather, in Philadelphia. But I grew up in a major city. I played sports. Through college, and I had some injuries. My brothers, had some injuries. So, but we never saw a therapist for any of them. And I only by happenstance encountered one when I was at Penn State as an undergrad. When one of my athletes, so I started out in athletic training. Well, I started out in biology, and then quickly realized I didn't want to work with Drosophila and do stuff like that. I mean, I was doing some pretty my work study job freshman year was in a plant pathology lab with my aunt and the PI. He was there, Tim, I think we were doing apple research and citrus greening research, and I was doing cereal planting and mixes and stuff, simple solution mixes and stuff like that. But I was like, yeah, I don't think I really want to do this for another 3 years. I want to work with humans. I only knew physician and surgeon. I knew about pharmacists, but I don't want to do a pharmacist. And then I knew about athletic trainers because I was an athlete. But one of our athletes had to go, and the way Penn State works is you have this probationary period when you're applying to the athletic training program. So I switched from biology to kines, athletic training, and one of our athletes needed to get rehab, and we went to a clinic. And they were working with this therapist there by the name of John Sayers Miller, or Sayers John Miller, but we call him John. And they were doing rehab, and I was like, this looks awesome. Like, who is this person? Is this an athletic trainer? Like, is this like a physician? Like, what is this? Like, no, that's a physical therapist. And I was like, oh, that's kind of cool. I kind of want to do that. And because they're doing like, manipulation stuff and all kinds of cool stuff. And they were in like an office setting. They're moving around. I'm like, he taught a little bit, had a PhD as well. I was like, this looks kind of cool. Like, I could do this. And then, so I switched out of athletic training because they wanted me to stop playing a sport, stop working. And you could only do that. And they're like, the message, like, don't use athletic training, stepping stone to another career. And like, I get that. Like, that's their department. But I was like, I don't want to be an athletic trainer. Like, I did this to go to medical school anyway. So I switched over to the general movement science option, applied to University of Miami with the plans of like staying in South Florida, working with athletes. And like, I had no plan on doing anything in cardio home or living in where I live now in the Midwest. I don't really like winter, to be honest with you. I don't like cold weather. But I had some very great mentors of mine down at the University of Miami, and Larry Cahalan, who by chance came there that year that we took his therapeutic physiology course, that showed to me that PTs did stuff with hearts and lungs. And I was like, I didn't know that was like something we did. And then I had Meryl Cohen, who was the first of 3 specialists in our profession, all 3 of which in cardio home, that was cemented my interest. I also had some early mentorship from Patricia Tedrick at the University of Miami Hospital, who's also another CCS. So long story short, I had, it was just mentors and, early experiences that guided my interests. And I, of course, have had opportunities to pursue those interests. So that's kind of what led me to where I am. But we can get into this about, lack of awareness, because like I think we talk about this lack of a public awareness of our profession. Like, I can speak to that, right? Especially in certain demographics. Like, grew up in a mixed household and in an urban environment. Never saw PT until I went to college. Like, played sports, had a back injury as a college wrestler. My brother broke pretty much every bone in his body, but that exaggerating.
Right. He constantly was injured. Yeah.
He was constantly injured. And it was all like fractures, like weird. Like his guy sprained both his ankles at the same time. Like amazing athlete. Just like, I don't know how, but I'm kidding. But we never saw PT. And, it makes me think like, yeah, like we don't serve some communities as well as we probably could. So.
Yeah, it was so true. I love your journey because like many others, it's this journey of like discovery for physical therapists. It's not like we go out, it's like you grow up and it's like, I want to be a lawyer, a doctor, or a physical therapist. You never hear that because they don't even know. People are like, is it a massage therapy? Like, people have these really bizarre concepts of what we do. And you went through that path in your way of discovery. And I loved how you discovered it. The second piece is the mentorship side. Like, you didn't say much about those names, but I felt the respect as you mentioned their names. You couldn't help but mention them because they obviously had a huge impact into who you are today. What were some of the core like concepts that, and not like, not so much treating concepts, but what were some of the values that you learned from these mentors collectively?
Yeah, and I'd say, as well, like with my, it was them, and then, my mentors that I've had at the VA in Madison, Wisconsin, Jim Carlson, and Stacy Brixon, and then of course at UIC with Shane Phillips and Ross Arena and Aaron Kyle, and Tracy Baynard. But and Barb Morgan can't skip it. But all of them, and I think that also speaks to a point that like it's, you're gonna have multiple people that influence you, right? And you take a piece of all of them, but I think, and they're all unique. All of them provide different, unique things that have made huge influences and changes in my life, and directed it and provided opportunities for me to direct it in a different way. But at the core of it was they were knowledgeable, incredibly knowledgeable about their area of practice or profession, and they were passionate about it, their energy, their enthusiasm for what they did was just electric, contagious.
Wow.
And it rubbed off on you, and you couldn't, you couldn't not be interested in that topic when they were talking about it. And
Yeah,
I try to emulate that, in my mentorship, in my education. And they were generous. That's probably the biggest thing. They're generous of their time, generous of their knowledge, and their mentorship. I mean, Larry, or I call him Larry now. I can think of countless times I would just hang out in his office, just asking questions, and he would always just be willing to talk to me about them, and we led to an independent presentation we gave at CSM, in addition to my research stuff we had to do as students in Miami, and same thing with all of them. Like I mean, there's so much was just. I mean, another bit of advice to students is just reaching out to people, and like asking, because I think a lot of that is just you kind of have to take the initiative, but as someone who is in a mentorship role in any capacity, I think those are the three biggest things is, you gotta know what you're talking about. Like that's pretty important, because people can see through that pretty quickly.
Yeah.
And then, be passionate, and then be generous. And I think there can be, maybe you don't have to necessarily be excellent at all three of those things, but maybe 2 out of 3. You got to be passionate and generous. Like those are probably the core elements of all of them.
Yeah, I love, man, this is gold. So here's the thing about what you're saying that I think is important for people who are watching and listening is that, we are highlighting heroes, people who've done way more, who've been able to influence, and the journey is through discovery and mentorship. No one becomes a hero without the help of multiple heroes coming together to help educate, inspire, all those things that were done. And you now are in a stage where you are now influencing others. So if there's a theme for today that I think is like the topic, it's about positive influence.
Yeah.
It's something that obviously you've experienced as the mentee.
Yep.
And you're on the other end of it now. Can you talk a little bit about how you mentor in both your, just talk about some of the things you're into, and I'll give the audience a little bit of a warning. Rich is very humble around these things. So he's involved in so many things that we might dig a little bit here, but yeah, talk to us about what you're doing professionally and then otherwise on social media, all the things that you're doing to help influence positively.
Yeah, and I'd say the core mission for me is kind of what you put out into the world, right? Kind of comes back to a certain degree, and what you've received, you need to put back out, right? Yeah. So I've received, from the time I was a little kid, right? I received, growing up, I grew up in pretty humble beginnings, and opportunities were provided for me to do things that no way my family would have been able to afford or do or have access to us. So, I learned early on that, I became very grateful for those things, and I had a firsthand experience of the value and the impact you can make from being generous, right? And be generous with your time. So that's a lot of what I try to do, with mentoring people. Like understanding, realizing where someone can go, right? Like where they can go, and then what I can do to help along that path. Because the way I view it, it's I never view, and this was with any interaction, that helping someone else be great, right? Or someone else just being great in the same field helps me too. We're all part of the same profession. Like, someone, I know the old adage, right, in the Bible, like for him to increase, I must decrease. Like that's true to some degree, but like everyone, if one person's successful doesn't make you unsuccessful, right? And, lending your expertise and being generous with your time, and being committed to someone like that's good, and that's good for everybody. So if you can help, and so that's a lot of what I do. Like I try to be. I mean, some people who have said like it's kind of in how to phrase this, like there's thankful of like the guess the generosity, it almost seems like, kind of, I wouldn't say over the top, but like, I go out of my way to like make sure people that, are near to me and that I care about, that, I do everything I can to help them along their way. Right. Because I mean, teaching, for example, I have a few people that have, taught with me as adjuncts, and like every year, we have a plan, like, all right, like what's, now that I have it, core faculty positions and I've been teaching for a while, I'm like, all right, like let's get you to that level too. Let's give you a pathway to doing that. Let's see how you can take on a bigger role. And then, whenever you're ready to apply, let's strategize and get you, in a position where you're going to be successful. Don't have to do that, right? And then again, and with other things too, with research, just, so yeah, it all goes back to being generous and putting things back out that you'd like to have come back to you, as well as, emulating the things that you've received that allowed you to be successful. So was it giving it, pay it forward, giving it back, whatever the cliche word is, right?
But what drives that for you? I mean, I get that sense of generosity. It's abundant, that obviously you've had some experience receiving that, but like, I don't know, like you just light up when you're talking about it. What is it that's driving you to pay it forward?
Feels good, man. I don't know. Like, I don't know. Like, it's the right thing to do, right? I mean, life's about trying to do the right thing as many times as you possibly can, right? And again, like, I really believe, I mean, we can get down in the deep core missions of what drives me, but probably, a little bit of the Catholic faith and, your life through works, and, that's an important thing, right?
Sure it is.
Grace through works, right? That's a big part of it. But I just think it's good to do good things, right? And like I said, like someone else being successful from, and me providing an opportunity for that, like, even though maybe I don't get like, I don't get like a check mark on my CV for it or something like that, but like that, if I realize someone, could do really well if they were just connected to that person, or if they, if I could, give them an opportunity to help teach, or give them a little bit of guidance on, how to align their infographics, right? Or a little bit of guidance on a publication, or a little bit of guidance on here or there, or just some encouragement, right? Like that's good. You're putting good out into the world, right? And like you live in the world, right? So,
it serves you. It serves you to put it out there because you live in it, and it's important to make sure that you, totally.
And I mean, and maybe there's I don't know, like, maybe there's the ego side to it. Like you have a vision for how you want certain things to kind of look, right, in the world, and I'd like the world to look positive and again, those charitable and generous, and so you try to sculpt the world into those things, right? Like things that you value. And so, yeah, I mean, but yeah, it just feels good to help people, right? Like kind of, I don't think people do things they don't enjoy, right? Or feel good about doing generally, but yeah, it just, I have a vision for what I'd like the profession to be, and everything that I can do to shape it or direct it in that way, I'm gonna try, right? So,
well, let's get into that a little bit, because as you were talking about what motivates you to do it, I love the simplicity and the power of just, it's the right thing to do. You told me before, what we put out into the world is what we get back, of course. But it's interesting because you have this vision, and you are a significant influencer, right? You're a professor at multiple universities. You've created yourself as in some social media spaces as an incredible influencer, but you've also referred to yourself as the anti-influencer, because it's not something that you, like a lot of people, you're not out there looking to stand on your soapbox. So before we get into that whole comment, which I think I really want to talk into, let's talk about your vision. Where do you, because physical therapy needs help right now, where do you see us going?
Well, I will say I do get on soapboxes. I will say that, but the anti-influencer thing is 100% true. That I don't do things to gain a following, but my vision is in a broader sense, that we really become a well-recognized in the public's, because I think we have a pretty good, as much as people may say, you know, I think we have a pretty good footing within healthcare. I think most healthcare professionals know who we are, know the value we provide. I would say that's still, I mean, there's still sort of certain battleground things
Sure.
here or there, but I think that's more just, that's power versus recognition. I think people understand like what we can do. I think a lot of that's just holding on to power, but that's a whole separate ball of wax, and how money influences things. But that's a whole separate thing. But I'd like to see us in a place where we have more autonomy, where we're a standalone, recognized profession that does more, right? That does more than just you know, focusing on rehabilitation, which is the core element of what we do.
Sure.
Getting more into health promotion, but more or less being more of a pillar within our communities, supporting health. And that can look very different depending on how you approach it. But a beacon within a community of health. And that's where I want us to be better recognized as, and initiatives that I'd like us to be more involved in. And I think we are doing a better job of at now. But that's, and then realizing, which kind of goes within there, you know, from our training, whether it's within our training as you know, entry-level PTs or not, like that, you know, that we change the narrative, because I think this exists too in our profession, that if you're not treating patients full time, or whatever arbitrary number of people get, because people say like, I'm not in the clinic anymore, though I still see patients, like, and created the clinic that I operate in, so, or clinical service that I operate within, but that there's more to PT than just that. If you're doing, and that's part of the special issue we just published, or had published, about basic science and applied physiology, that, you know, just a case example, my mentor here, my PhD mentor, Shane Phillips, does more work in basic science. He does stuff with, like, you know, dissected, you know, cannulized microvessels. We do, you know, these vessels, you know, and I do more stuff with mechanistic work and respiratory physiology. And, you know, he would always joke that, you know, I don't even feel like a PT sometimes, you know, and people would say that, like, I don't go to PT school to work with mice or to work with cells or to do this stuff. Like, it's got to have a direct, but I'm like, yeah, you got a PT degree,
right?
You're also in a PT department. And like, if you're doing research and you got a PT, you're a PT, like, that's PT research, right? What you're doing, right, with the coaching and the billing, like, that's still PT practice in my view. And, you know, even education, that's part of PT. And I think removing this dichotomy of that, or this view that PT is just in the clinic, it's not. It's just not. And I think that opens because there's other things that you can do if we limit ourselves just to the four walls of a clinic. And even a clinic doesn't have to be in the traditional sense that we view it.
Totally.
You know, of evolving that to, you know, to multiple different avenues. That's where the higher opportunities for compensation or money making are, right? Because there's other ways to make money as a PT. Product development, like, that's still part of being a PT. You know, you're training, and I tell my students this, that it doesn't, we don't give you your training through PT school, yes, guarantees you, you know, a spot if you graduate to take the licensure exam, right? But it's not just a rubber stamp to practice. It's a way of reasoning. It's a foundation of knowledge that is applicable anywhere you want to use it. And there's a lot of places that could use your knowledge and expertise, and beyond, again, just the clinic. So that's my vision of really encouraging that. Yeah, so that's my vision.
You said it. I love the description of it. What you said in that phrase that like landed as maybe something we should put on a flag somewhere is a beacon in healthcare. Like,
Yeah.
I love what that does. And then you went right into addressing one of the issues regarding the dichotomy that people perceive. Like, what is it to be a PT? Even PT graduates, new students are thinking most of the time inpatient, outpatient. In our last month's interview with Heidi Janenga, she hasn't treated a patient in forever, and she's greatly influenced, and she's still being in PT by solving problems in it. And like you've done, and it's very similar to what you've done. You're, I actually don't know if you're currently treating patients in addition to everything else. I'd be shocked if you were.
Still am.
Wow.
Same on Monday and Fridays. Yeah.
How do you?
Mine like ties into my research. Like it's a separate clinic, but like bariatrics and stuff like that. So I mean, that's my passion too. But
amazing.
Yeah, no, it's I mean, people always say like, what's the whole like, you have the banner image in there, it depends. Like it's whatever you want it to be, right? Like you can go treat patients, cool. You can like go do research, cool. You can go be a business person and like do things within healthcare, even in things that like maybe aren't like specifically like adjacent or tangential to like PT. Like you can do things like, I think, I have colleagues are wanting health policy.
Yeah.
Like why isn't that a bigger thing? That impacts us. I'd love to see more PTs involved in governance, in health policy.
Yeah.
Right. Like why not?
Well, and it speaks to being like us thinking about ourselves from a place of we are equal to the rest of the members in the healthcare community.
Yeah.
That's part of this, is that sometimes for whatever reason, culturally, we've adapted this thought of like, we're a referral that you send out to, not a doctor in the community.
Yeah.
And that really influences some of this lack of awareness.
I agree that, those technician days are over, baby. Like, I mean, we're a profession. Like, I mean, I think that's where some of the resistance, some of the inertia, right, to these views is that we were for a large part of our history, a profession that was dictated, right? Like this is the order that you follow, right? And I think a lot of professions are in that similar growing struggle, right? Nursing to a certain degree, physicians assistants are in that, they're in a pretty active fight with that now.
Yeah.
And even pharmacists, that this is the prescription you follow, and you fill this prescription, but we have a very working knowledge of what we do, and you can take a little bit more autonomy because we're no longer, we don't just, right now, like you mentioned, it's not, what's the old script that you would get, treat,
eval and treat.
Eval and treat, and then you have prescriptive treat like ultrasound, heat, all that stuff. Like, no, it's like, well, all right, well, like, you decide what you're going to do. It's a referral, it's a consultation with a subspecialist. It's not a prescriptive thing.
Right. It's not like the family physician sends a patient to a cardiologist with, I want you to do an EKG and I want to make sure that you do the following examinations. It's like, no, he's like, hey, you need to go see so-and-so because they're great. And that's what we've created and maybe don't live up to as a profession. So is there any other problems that you see in the profession that are limiting us? You mentioned two things that I heard, like community awareness about who we are and what we do. But you also mentioned, of course, the idea that like what defines physical therapists in terms of their professional opportunities to help the mission of physical therapy, not just the industry, but the mission of it, to become a beacon in healthcare. You've mentioned it. Is there anything else that you see as glaring problems that limit us from getting to that vision?
Oh, we can't talk about any of those things without getting into representation and the financial barrier, really, or financial constraints. That's a big thing. Like I said, like I grew up, in an urban environment, low SES, low middle SES, and there were no PT clinics. I think there was a chiropractor, like sort of, I don't know, maybe had a PT sort of there. I still don't even know what was there. Like I growing up as a kid, and and I mean, a little bit of story. Like my mom, as a I was in high school. It was high school or college. She had two accidents. She got a car accident. One in particular, she got in a car accident, and she saw a chiropractor, or I guess it was a chiropractor. I'm not sure how it was advertised. We learned it was a chiropractor, and she went for like a year, never got really, better. And, that's just the thing. Like, that always eats at me that, like, and I went back and looked at like how the treatments she was given, which were completely bogus.
Yeah.
But, and that's one of my missions too, is addressing that so people don't get taken advantage of, because that does happen in certain communities. You get people, that there isn't good, there may be access to care, but the care is not good, right? It's not good. Like, and, one that hurts that community, right? Big time, because they're not getting the services that they deserve, that they're entitled to. And it hurts us, right? If we're PT in that space, providing bad services, or, again, not going to those things of, being genuine or generous and knowledgeable and passionate, right? Like, and then, because patients you've been in the business world, you own the clinic, that they're your biggest marketing tool.
Oh yeah.
Right? And that just, that perseverates, that perpetuates, the narrative about our profession, right? And I think there's a lot of that in not just PT. And I don't want to just wrap us. It's what I know the best, because I am a PT. But it happens in other disciplines too, that, like, these community, and sometimes it's no fault of the provider. They're in an environment that does not allow them to be successful.
Right.
But it's or is passionate, right? Or is generous, or maybe doesn't attract the most knowledgeable people. And and it just leads to a situation where certain disparities are just there. And I think that's a big problem. And I don't think we talk about that enough. It's interesting. I got a post about this, because I've seen this. Like, I've been in the profession now. I came to PT school in 2010. And, you look at posts for where there are jobs, where there are high paying jobs, right? It's in very rural areas, or very rough or urban areas, right? The jobs in the cushy suburbs, the jobs in the metropolises, let's get taken up. But no one, and everyone wants, it was like, oh, the job market's saturated. I'm like, it's not everywhere.
No.
Right? It's not everywhere, and I think that's a bigger thing we need to talk about. Like, how do we encourage people to get out into those communities? Because I have friends that said they work in, like, rural Oklahoma or Idaho. Like, I've been trying to find someone to work here for like 2 years, and no one wants to move out there. And I think, and then the cost, like, it's getting to a point, if it's not already at it, that the cost to be a PT, it's almost not worth it in some degrees, to some degree. And I think, I don't know where exactly to place the blame on. I don't think it's ever a single person. I think the federal government has some blame to take for that. Universities have some blame to take for that. And our profession as a whole has some blame to take for that. In trying to, put a little bit more influence and saying, hey, like, we're going to price ourselves out, or price out people from lower socioeconomic demographic or underrepresented minorities from pursuing our profession. We don't get the same policies as physicians get, for tuition reimbursement, or we don't get paid the same. And the same even thing for nursing. If you look at, I think, demographics for nursing, way more diverse than PT. Same thing for PTA, right? Because I grew up in that environment. Like, if you grow up when you don't have a lot of money, you're not going to go to something, like, you're very conscious about, like, what's going to give you a good return pretty quickly. So I think those are big things. Our representation, where we're located, and then the cost. Like, we got to do something about that. And I also think that ties into changing who we are as a profession, because people can disagree with me about this.
Yeah.
Until they're blue in the face, and I will stand firm on this. That if I think our profession has over leveraged musculoskeletal care. I think we've over leveraged that. I think that's an important part, but the health promotion aspect has been severely under leveraged. Let me ask you this.
Yeah.
right? You worked in private practice, and now here's me getting on one of my soapboxes, right? But
Let's do it.
you got you worked in outpatient practice, right? I assume. What would you say would be the percentage of individuals coming into your clinic, irrespective of diagnosis, that had some sort of cardiometabolic impairment or health condition?
A large percentage.
Would you say it's rare that they wouldn't?
No, as a matter of fact, it's almost when you're doing the medical history, it's like you start writing in HTN, hypertension as soon as they show up, because you're above a certain age. It's almost given that they're going to have some aspect of that.
Yeah. And if you look at the general population, the population statistics for obesity and overweight.
Yeah.
66%, it's 66 to 70% overweight obese, 40% obese. 20% of people meet the recommendations for physical activity, which is both resistance training and aerobic exercise. And then you look at sleep, right, which so, and the crazy thing is these things are incredibly common, right? Impaired sleep, right, as well, which that's also a big thing. These all affect a lot of the conditions you're seeing. And I'd even say, and I've been on the record of saying this, and there's people that would agree with me who are more in that purely musculoskeletal space, that a lot of, especially chronic musculoskeletal pain, is an output of some of those lifestyle factors that are being not addressed or under addressed, or maybe out of balance, right? If you're not active, if you're carrying too much adipose tissue, if you're not eating well, if you're not sleeping well, you're gonna have more chronic issues, and pain's kind of within there, especially.
Sure.
Especially with the sleep. And as of right now, you as a PT, for a referring diagnosis, and I know this because I work in bariatrics. What I do is I work with patients going into weight loss surgery and following weight loss surgery. That I can't, an admitting diagnosis for me can't be obesity, or a billing diagnosis. I can't bill with an ICD-10 just for obesity, or hypertension, or even in medicine, physical activity isn't still something that's a broader issue. But I can if I could demonstrate some sort of muscle weakness or impairment, I can bill for deconditioning or muscle weakness. But if I think inactivity, if I think maybe obesity is contributing to some of their issues, I can't bill for that. I have to do this rat race thing to figure out how I can get reimbursed for the services that I'm providing. They're benefiting my patient. And then because of that, I don't think we do enough, because it's not a clear connection. We don't lean into that as much as we possibly could. And I don't think because of that, patients don't see us in that vein. And so if you want to talk about reimbursement, if we could address the cardiometabolic epidemic in this country, especially in certain demographics,
sure,
that's where the money is. I mean, the AHA and the American Heart Association, American College of Cardiology, and their revised guidelines that everyone got up in arms about, because they changed the blood pressure cutoffs and they moved them from 140 to 130, and people are like, oh, they're just kind of over medicalized and over prescribe people. I'm like, getting people enrolled in the medical system who have hypertension even above 125 is a good thing, because we know the predictive values of untoward events with hypertension. But within their guidelines, the first step for all of them, unless they had a significant risk factor for stroke or heart attack, was non-prescriptive means. However, you look across the country, there aren't enough cardiac rehab facilities. You can't get admitted for hypertension. You can't, but they can't go. And there's PT clinics everywhere. And we're already seeing those patients for other things. But I can't bill a goal for blood pressure. I can't bill a goal for weight loss. I can't write a goal for sleep. I can't write a goal for physical activity.
Right.
Makes sense of that. And I think, and that's where we could go big time as a profession.
I really hope people are listening to this, because, it's interesting. Again, the whole point of this, of us recognizing the heroes in our industries, because the heroes think differently.
Yeah.
You know, like whatever else we do in terms of serving people, you know, Rich, it's like, you know, maybe we're helping them in your world, you're helping them create a community on Facebook so they have some place to learn and grow. In my world, I'm helping people increase income, impact freedom. But regardless of that, who we are as people trying to influence is that we're trying to change how people think in our profession specifically. Because if we occur to ourselves differently, not some service that gets referred out to doctors in our communities, then we can discover what's possible. And people like you who've been doing it so long, so successfully, you are able to get a clear picture of what that vision could look like. And you just went down a whole descriptive piece around what we should be doing as a profession, which is helping healthcare not be reactive, but proactive.
Yeah.
What would it look like if we had people saw us? First of all, we'd have to see ourselves this way, and then we'd have to educate the community. But if people and we saw ourselves as those influencing individuals just in that healthcare space, how would it look like to have people come to us once a year for a physical therapy examination as a checkup, to be able to look at the muscular imbalances, the musculoskeletal systems, but also the cardiovascular and all these other related components that we could guide them? The impact on our healthcare industry would be massive.
And the great thing is too, you know, especially for blood pressure, you know, we've got prognostic data that suggests, you know, if you demonstrate post-exercise hypotension in recovery, you know, after you've rested after exercise, your prognosis for improving your blood pressure with exercise is pretty good. And we're the only profession in healthcare that can systematically do that. Like, because we have bikes, we have all these things, and our patients typically warm up on something, even at the eval. So, you know, we have the tools, we have the infrastructure, and I noticed I've published the research. We won an award for that paper that, you know, suggests this. And then but you know, along with that paper, like people, you know, just to show that where we need to change things, like the vast majority of outpatient PTs don't even measure blood pressure and heart rate. So I think that's getting better though. And I think some of that, you know, the Vitals or Vitals campaign helped with that, and other different initiatives we've done to move that ball forward. But that's you know, I think that all encompasses, at least with my vision, is again that beacon of health. And hopefully with some of this, you know, I'm now a APTA House of Delegates, you know, member, you know, hopefully we can start. And there's it's not just me too. I mean, Mike Eisenhart, Patrick Berner, you know, Mark, you know, Lisa, Todd, all those people have been really, you know, been big behind it. And I think there's momentum now. And I think the newer generation is hungry for that. I think they come in with this. Again, we talked about the growing pains of moving away from the technician to the autonomous provider, and I think they come in with that mindset. And I mean, I guess I'll say kids, but you know, I'm not much older than they are. But like they're motivated, man. Like they're hungry, and I think that we've got some pretty exciting things on the horizon with what's coming up with this newer generation for sure.
Well, you're a huge voice in that. And I just, for me, as we look at moving forward, and one of the things that I have seen you as is this voice for that next generation. I get that sense from you that like they are hungry. We can either feed them or starve them. If they starve, they'll leave the profession. If we feed them, they could change the profession for us. So what's one or two? There's probably like a whole different interview. And I really would like to talk to you again. This has been fascinating. Sure. As we wrap things up, what would you say is one or two key things that you would like the up and coming generation to know, something that either they can do or something that they should think on to help shift healthcare towards the vision that you painted?
Yeah, so I have a pinned post on my my Twitter, and I said this to my students as well, that be a PT, and this encompasses both of those things. Be a physical therapist in the community, not just the clinic, right? Wow. And that it goes into everything in terms of changing who we are as an identity. And apologies, I talk with my hands, like I'm Puerto Italian, so I don't know if I blocked the camera or not, but yeah, and I think that speaks to it, right? Like, and it's okay. It's okay if you view PT as just a job that you do when you're there. That's okay. But I'd like the broader profession to start viewing ourselves beyond just the what we do within the corridors of a clinic. And again, even a clinic by itself can be different. So I'd say that's the biggest thing. Is let's change our view as to who we are, not just within healthcare, right? But who we are. Because I think physicians view themselves that way. I think lawyers view themselves that way, and other professions, that you are part of the community. And I think that's the biggest change, and that's the biggest difference, I think, between, when we talk about, what is a true profession. We talk about the core values of altruism and all these different things. But I think the bigger, broader view is that you are an entity within a community. You're not just someone who has a job that works at the store, right? Or works at the factory, right? Like, those people are important, but their role is more of a citizen within that community. You are an entity, right? You are a beacon of health, right? Lawyers are a beacon of the law, of justice. Police officers, same thing. A clergyman, right? Or clergy person,
sure.
Or just clergy, I guess is the technical term. But those you're an entity. You're a source of knowledge, and you need to be generous. You need to be passionate. You need to be knowledgeable. And I think that's the bigger thing. And then in terms of advice for students, don't get enamored with being popular. Don't get enamored with getting a large following. And you and I talked about this. Get enamored with getting really good at what you do. And the rest kind of falls along. And that's the same thing even with grades. Like, don't worry so much about, what's the whole thing we talk about in motor learning, like performance, knowledge of performance, knowledge of whatever, the results versus performance thing, knowledge of the results, knowledge of performance.
Yeah.
Focus on mastery, focus on becoming knowledgeable, because when you have that expertise, right, that's really the whole evidence-based practice thing, right? People throw in the misnomer of experiences in it. It's expertise. So that's the ability to take your patient's value systems, the existing knowledge, and apply it to a narrative that's coherent and logical. And you only get good at doing that if you are dedicated, if you are, I'm gonna say, even obsessed with mastery. And that makes it easier when you don't do well on an exam. That makes it easier when you're following, if you really want to do that thing and be an influencer, isn't where it is. It'll get there. But if you're really good at what you do, and then people start to recognize you for that, that'll come. That's not to say that, like, having a big following, that having perfect grades, aren't important, but being obsessed with getting the most out of your education is probably the biggest thing when you're a student. And that's why you went, right? You went there to get expertise. You might as well get do that while you can, because it's harder and harder to do when you're in the working world,
right?
Unless you're in academia. But even then, you still need to seek out mentorship and constant refinement of practice. But be a PT in the community, not just a clinic. And again, that's not to say that those things are, there's a dichotomy to that either. And really be obsessed, and that could be with anything, right? Like, I mean, obviously when you're in school, while you're in school, but when you start getting into practice, like, or whatever you want to do, like, just go all in, and the rest will kind of take care of itself. So that's what I'd say.
I really hope students in particular and new graduates will listen to this. That whole bit right there, massive. If everyone would follow that, how different our profession would be. So, Rich, I know this, I can't thank you enough. Your experience, your impact on our profession is exactly what we need. We need so much more of it. And I loved this mentality of, like, we can all win together. It's not a competition. We're going to get there if we mentor, if we're mentors and mentees. If people wanted to get in touch with you for anything at all, what are some of the resources that you have out there for people to be able to grow, learn, develop, that kind of thing?
Yeah. So I mean, I guess it was clever, 9 years ago when I created P2 Reviewer as an entity that I use to interact with people on social media. But you can follow the website, ptreviewer.com. There's all the, and at P2 Reviewer, it's the same on Facebook and Twitter. And then Instagram, it's PT_reviewer. I don't know how someone came up with that. Like, and it's not even huge. I wish I could buy that page just to keep everything consistent.
It's the one thing that's not the same. It's like a thorn.
I know. It's so annoying. Yeah, those, and like, I have stuff, published work and then stuff on MedBridge if people are interested in that. Again, even my code on MedBridge is PT Reviewer, all one word. But those resources, and like I have a YouTube channel with stuff, but like that's mainly just like lectures for my students. So like, you want to listen to how I teach cardiopolymer physiology, like go for it. And then Cardiopolymer PT Journal, I'll go plug for that. It's the journal I'm associate editor for. But and the other thing I'll also mention too is share joy. Like that's the thing that I think more people could do a better job of in general. And I think, people when they first get to know me, and I think this happened even when I was in PT school, like I would get super excited. Like I would post things like, I'm going to go dominate this exam. Or then I passed, like dominated this exam, or like, I think initially it rubbed people the wrong way a little bit, but I think they soon realized, like, I'm not competing against anyone besides myself. And I know how hard I worked. I know what I had to do to be successful on this, whatever I accomplished or the challenge I overcame. And I'm going to share that. I'm going to share the people that care about me. And if you want to share joy, like that's good for everybody, right? If everyone's a little bit more happy and sharing the positive things and lifting other people up. So, work hard, but like when you do well, like be happy about it, man. Like share joy, like, and people that care about you want to hear about it, So that's my whole thing. And it rubs off on people. It's contagious. And maybe that's, my mentality from playing sports, but like, yeah, you make a big play, you celebrate, man. Like, and and then and the generosity stuff too. Like be willing to help people. So yeah.
Powerful words. Rich, I can't thank you enough. And congratulations again for what you've created. And as we heard from you directly, if we want to influence our patients, the profession, our own personal worlds, it's going to come from a place, like you mentioned, of generosity, being willing to be menteed, to learn from those great mentors. And that's obviously what we've done, is highlight a great mentor here. So find those mentors and then be willing to mentor others so that you can be that change in the industry and share joy along the way. So Rich, thanks again.
No worries. Well, hey, thanks so much, man. And keep up the great work with this podcast and channel.
Well, it's an honor for me. Honestly, no one learns and grows more than me. So for all of you who are listening and watching, thanks for tuning in. I am confident that you will go to your day differently because you got to hear what Rich had to say. And so thanks again for tuning in. Until next time.